Welcome to Trauma Informed Vaccine Conversations with the Washington State Department of Health. Today I'm joined by clinical psychologists Dr. Kira Massa, Dr. Tona McGuire, and Dr. Michelle Andrasik for a discussion about trauma-informed vaccine conversations during the COVID-19 pandemic. Dr. Andrasik, people are coming in for vaccines with a variety of different backgrounds. What can you tell us about why some communities may not want to engage in healthcare like getting vaccinated?
Well, many communities have a precarious relationship with the healthcare system at best. Many people point to instances like the egregious research and medical practices on the Havasupai Indians, the Tuskegee. Well, it's not really the Tuskegee experiment. I was informed by a professor at Tuskegee that it was the U.S. public health study that was done at Tuskegee University, and that it's been misnamed. But anyway, we have this long list of areas where people have been treated poorly and unethically based on their identity, generally devalued identity. And, I think often we stop there and we just think about like these past egregious behaviors and unethical behaviors. But if you talk to a lot of people, they will tell you that the way that they were treated yesterday, or that their aunt was treated last week, or that their mother was treated a month ago, is really the driving factor of mistrust and sort of these precarious relationships we have with the medical industry generally. So we don't have to go too far back to see like modern day and contemporary discrimination and biases that play out in our day-to-day interactions with medical staff or people who are there to provide help and assistance. So, and the more devalued identities people have, the more likely they are to run into these experiences where they feel devalued or dismissed or ignored in these settings. So I think, it's a combination of what we know to be the history of medicine and medical care and research in this country, and our own, day-to-day experiences with the medical system as people with devalued identities.